Addiction is a disease of isolation, and recovery from addiction means reconnecting with other humans. We really use our drug of choice as a kind of replacement for the deep, intimate human connections that we need to survive and thrive. I do want to emphasize, though, that you can have like the perfect relationship and the best family and the most wonderful network of friends, and you can still get addicted. And what your addiction will do is pull you away from those individuals as you replace those meaningful relationships with your drug. And that's what we see happening all over today.
So I'm extremely excited for this episode. I'm here in San Francisco in this amazing location. So shout out to SF Podcast Studio, and I have an incredible guest. So Dr. Anna Lembke, you are a professor of psychiatry at Stanford University and also the author of a best-selling book, Dopamination. In Italian, the title is L'era della dopamina. And I believe that your work has deeply impacted how we think about addiction, how we think about dopamine. And I'm really curious to understand what led you to choose this career path.
Well, first of all, thank you for inviting me. Welcome to California. I'm really glad you're here. It's lovely to meet you. And so you're asking, how did I decide to go into addiction specifically? Yeah, that's a longish story, but I'll try to make it brief. I initially didn't want to have anything to do with patients with addiction for a number of different reasons. I didn't have much training in how to treat people with addiction, even in my psychiatry residency. So not much training in medical school, not much training in my psychiatry residency, which is sort of surprising. But we just, this was 25 years ago. We just didn't get much training back then in addiction. I was also the child of an alcoholic. My father was also a physician, a surgeon, high functioning, but he was a binge drinker, and he would have periods when he was completely checked out because he was drinking. So I had what we call negative countertransference toward patients with addiction. That's just a way of saying a lot of negative bias, that some conscious, some unconscious. So I think it was the combination of not having the knowledge of how to treat them and feeling like, well, those aren't really my patients. Those aren't people that I am responsible for. And those aren't even people that are helpable. So this was also, I think it's a prevalent idea that people with addiction are unhelpable, that they have to want to change, but nobody can make them change. Those things are not necessarily true. There are a lot of things that we can do to incentivize recovery. But what happened was I had a patient who was doing very poorly. I was prescribing a lot of psychotropics, antidepressants, mood stabilizers. And I had no idea that she was concurrently injecting heroin daily. It was only when she got into a car accident and her family let me know that I realized that all the time that I had been seeing her, she was actually using heroin. No wonder she wasn't getting better. So that was really a turning point in my career where I realized, wow, I've been ignoring this whole side of mental health, and in ignoring it, really harming patients because it was a kind of a don't ask, don't tell. Like, I'm not going to ask about drugs and alcohol, and you're not going to tell me about them, and we're going to pretend like we're treating you when in fact there's no real treatment happening.
Have you yourself had any experience with addiction and like this kind of, dopamine levels, processes?
Yeah, great question. So I was, as the child of an alcoholic, I'm certainly at increased risk for alcoholism and addiction more broadly. We do know that if you have a biological parent or grandparent who has a drug or alcohol addiction, you are at about 4 times increased risk to get addicted yourself compared to the general population. And that's true even if you're raised outside of that substance using home. So for example, we know from adoption studies that the risk is about 40 to 60% genetic or inherited. But for me, alcohol was never reinforcing. It didn't relax me. It didn't make me happy. It just gave me a headache. So I thought, oh, great. The addiction gene escaped me. I didn't get it. But the truth was I just hadn't yet met my drug of choice, which turned out to be in the realm of romance, attachment, intimacy, sex. And I got a little bit addicted. So it wasn't a severe addiction, but I did develop a problem with compulsive romance novel reading. And I write about this in my book.
Yeah.
But in my early 40s, I sort of discovered the genre of romance novels, starting with the Twilight Saga, which, as you may know, is this vampire romance genre. But what happened was I got a Kindle, and with the Kindle, my e-reader, I just had this incredibly easy access to high volume, very potent novels. And over about the course of a year and a half, I finally found myself like reading all the time, reading late into the night, taking romance novels to work and reading in between patients, taking romance novels on family vacations and hiding in the bedroom and reading, to the exclusion of other things that I value, like spending time with my kids and my husband. So it wasn't like a life-threatening addiction, and I wouldn't want to trivialize very severe life-threatening addictions by comparing my situation to that. On the other hand, it was interesting how much my experience mapped onto the experiences that my patients were having. That is to say, kind of started out for fun or to solve a problem, found it highly rewarding. It really worked to, escape my everyday life. And then with technology and the way that technology has kind of drugified so many of our experiences, very quickly found myself in this accelerated mode of consuming lots and lots of my drug of choice, which turned out to be romance novels, developing tolerance, so needing more potent forms to get the same effect, finding myself now reading kind of frank erotica, really, socially sanctioned pornography for women is what I think of it. And having problems as a result. And that's really the definition of addiction, the continued compulsive use of a substance or a behavior despite harm to self and or others.
It's very interesting because one thinks that when you study so much a certain theme, then you could be immune to the processes that are behind it. And so knowing that even you that devoted your life, your career to studying how addiction works also fell in this kind of trap and you found yourself in this mechanisms of addiction is extremely interesting. I want to deep dive later on addiction, but I really want to ask you first this question because we often think and we often hear this word dopamine, dopamine, dopamine. And why would you say that today it is so important to talk about dopamine, to understand what dopamine is and how it works for us?
Well, dopamine was discovered as a human brain neurotransmitter only in the 1950s. So we haven't known about it in humans all that long. And since the 1950s, there's been an absolute explosion in research on dopamine, what it does in the brain. And it turns out that it has a very important role in pleasure, reward, and motivation. Now, it's not the only chemical involved in that process. But it has become kind of like a common currency for neuroscientists to measure how reinforcing or rewarding a substance or behavior is, and also to examine what happens in the brain when we become addicted, because we have very good science now showing us what are the brain changes that occur in addiction and the fact that addiction is a brain disease.
No, it's very interesting. And like, what do you think are the main misconceptions about dopamine today? If you, I don't know, have this exposure to this topic, and what do you think are the, I don't know, false myths or some things that you think are not right, but are still going to be like where the conversation is focusing on that? But
yeah, well, I mean, I think dopamine has kind of become a metaphor or a meme, and that's okay. And it's good to have kind of an understanding of some basic mechanisms
Mhm.
that we can carry with us in our everyday lives. I think probably the common misunderstanding that I encounter is that people think they're addicted to dopamine,
Okay.
right?
Yeah.
Or that dopamine is bad, and if I have too much dopamine, that's not good.
Mm.
And that's not quite right. I mean, dopamine is a powerful and important signal for our survival. We
Mhm.
need dopamine to survive, right?
Why? Why so?
Because it tells us, pay attention to what's going on right now because it's important to your
Mhm.
survival. And this is something that you need to approach and explore as opposed to something that you need to withdraw and avoid, right?
Mhm.
So, if we didn't have dopamine, we wouldn't know what to pay attention to,
Mhm.
and we wouldn't be able to survive, right?
Mhm.
There's a very famous experiment where some rats were engineered to not have dopamine receptors in a key part of the brain called the reward pathway. And what the scientists discovered when they worked with these dopamine depleted rats was that if they put food in the rat's mouth, the rat would seem to get pleasure from the food and eat the food. But if they put the food even a body length away, the rat would starve to death.
No way.
So we need dopamine in order to be motivated to go get the things that we need to survive.
Yeah.
And addiction is characterized by an imbalance in dopamine firing. It's where we ingest things that are so powerfully eliciting of dopamine that it confuses our brains.
Mm.
And then our brains have to adapt by downregulating dopamine transmission and production, not just to baseline levels, but actually below baseline.
Mhm.
And then we get into this chronic dopamine deficit state, which is the state of being addicted.
Yeah. Like in your book, The Dopamination, you talk about this pleasure pain balance. Would you explain like what that is and what is the role of dopamine in this process?
Yeah, so I use this extended metaphor of a pleasure pain balance like a teeter-totter in a kid's playground, which represents how we process pleasure and pain. And one of the most interesting findings to me in neuroscience in the past 75 years is that pleasure and pain are co-located in the brain. So the same parts of the brain that process pleasure also process pain, and they work like opposite sides of a balance or a teeter-totter. When we do something pleasurable, it tips one way. When we do something painful, it tips the other. But there are certain rules governing this balance. And the first and most important rule is that the balance wants to remain level with the ground, or what neuroscientists call homeostasis, such that with any deviation from homeostasis, our brains are going to work very hard to restore a level balance. And how our brains do that is essential for understanding addiction. So let's say in my case, I read a romance novel or I eat a piece of chocolate, which I also love. Since those are reinforcing for my brain uniquely, now they're also reinforcing for many other people. Not all people, though. We're all a little bit different.
So pleasure.
Right. So I get pleasure. That releases a lot of dopamine in my reward pathway, and my pleasure pain balance tilts to the side of pleasure. No sooner has that happened than my brain adapts to increased dopamine firing by downregulating dopamine transmission and production. That's called neuroadaptation. And you can imagine that as these little neuroadaptation gremlins hopping on the pain side of the balance to bring it level again.
Okay.
But the gremlins like it on the balance. So they don't get off as soon as it's level. They stay on until the balance is tilted an equal and opposite amount to the side of pain. That's the come down, the hangover, or just that moment of craving, wanting to have one more piece of chocolate, even though I told myself I would just have one, or to read one more chapter, even though I promised I would close the book and go to bed.
Yeah.
Now, if we wait long enough in that state of craving and we don't consume our drug of choice, then the gremlins get the message that their work is done. They hop off.
Yeah.
And homeostasis is restored. And that's a healthy, functioning pleasure pain system. But if we continue to consume our drug of choice over days to weeks to months to years, what happens is those gremlins on the pain side of the balance start to multiply. They get bigger and stronger. And eventually they are camped out there. And now we've entered addicted brain. We've changed our hedonic or joy set point, such that we need more of our drug in more potent forms to get the same effect and to level our balance. And now we're not even getting high when we're using, we're just trying to feel normal. And importantly, when we're not using, those gremlins stay on the pain side of the balance. And now we're walking around in pain, right?
Okay.
Experiencing the universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, insomnia, depression, and craving. And this is what drives reuse, even when we told ourselves, I'm going to stop, I'm going to stop.
Yeah, that's why it's so difficult to say, to force yourself. And so if I understood correctly, the more you decide, once you're on the pain side, the more you decide to tap into the pleasure. So you want to reinforce the pleasure part of the balance. The more the pain one becomes like stronger, and the more difficult it becomes for you to restore the balance. So to go back to a normal level of homeostasis. Is it correct? So
yeah, that's right. So to say it another way, with initial exposure to any reinforcing substance or behavior, right, we get an upward deflection of dopamine firing. The balance tilts to the side of pleasure, but it's followed by dopamine free fall below baseline, what's called the opponent process mechanism, all in the service of trying to bring us back level. So we go to pleasure, and then we don't just go back to homeostasis.
Yeah.
We go to pleasure and then pain and then homeostasis.
yeah.
But with repeated exposure, that deflection to the pleasure side gets weaker and shorter in duration, but the after response to pain gets stronger and longer. And ultimately, we can get stuck on the pain side of the balance.
Yeah.
And now we're in addicted brain. We've changed our joy threshold. Now we need more of our drug in more potent forms to get the same effect. And when we're not using, we're feeling lousy.
I can feel that there is this willpower thing that you need to use when you're in this, I don't know, like pain side, and you don't want to, I don't know, get the additional piece of chocolate, or you get into this other loop. Is it that so it feels like this willpower is saving you from this addictive brain or this addictive behavior? Is it like as it sounds, or?
Well, I mean, willpower is helpful, but it only goes so far, right? I mean, willpower is not an infinite resource. When we wake up, we have more willpower than we have at the end of our day when we're going to bed, whenever that may be.
Yeah.
And what is very characteristic of the disease of addiction is that willpower essentially isn't working for us anymore. Even, the exertion of our willpower is not enough to overcome the gremlins on the pain side of the balance, or what we often refer to as the hijacked brain, where that drive to get our drug of choice is really becomes mistaken in our brains as absolutely necessary for survival. So remember, dopamine is a neurotransmitter of survival, right? It says to us, you need this to live. What happens in addiction is that we confuse that drive for survival with the drive to get our drug of choice, whatever it may be. And then we cling to that for dear life because it feels like I'm going to die if I don't get my drug right now.
Wow. But do you think that this world in which we're living is making things very hard? Like, I feel that it's very easy to get trapped into this addictive brain. Like, even social media are designed to create this I don't know, feeling of I wanted more, I wanted more, I want to scroll more. Let me see who has liked my post, but also food that is extremely accessible. How do you personally navigate this in your life? Like, how do you balance, or which suggestions would you give for us to walk around this extremely full of stimuli world and preserve our sense of, I don't know, balance, knowing that we cannot always tap into willpower because it's hard.
Right, right. Well, as I say in the book, if you haven't experienced addiction yet, it's coming soon to a website near you.
Yeah.
So I do think that, we are living in a time and place when almost every human activity has become drugified in some way. It's been made more accessible, more potently reinforcing, more novel. Dopamine really responds to novelty or newness. More bountiful. There's more of it, which means we're exposing our brains to it all the time, such that I think both on an individual and collective level, we are all kind of in a chronic dopamine deficit state, more vulnerable to addiction, not just to traditional drugs, which are more potent and more accessible than ever before, but also to brand new drugs that never existed before, including all of the different types of addictive digital media, online pornography, online shopping, online video games, social media, as you mentioned, which is essentially drugified human connection, right? So why do we fall in love? Because it feels good. We know that falling in love releases oxytocin, which is our love hormone, which actually binds to dopamine releasing hormones in the nucleus accumbens in our reward pathway. So we get high when we fall in love. But social media has essentially drugified this experience. Now with almost no upfront work, we have these highly reinforcing stimuli that we control in an iterative, interactive way with likes and shares and comments and posts. And by the way, there's neuroimaging studies showing that when we post something online and anticipate a response, that releases dopamine in the reward pathway, the same as drugs and alcohol. And that with social media addiction, we actually get this downregulation of D2 receptors, which is another way of saying we go into that chronic dopamine deficit state with the gremlins camped out on the pain side of the balance. So we've got the same phenomenon happening in the brain as we are getting addicted to these brand new, forms of online media. And, you don't need a degree in psychiatry to see that. You just need to walk around any shopping mall or any airport or anywhere you go, and people are glued to their phones, really kind of in a trance, like they're gone. So it's a very tough world to stay sober in. You asked me, what I do or what I recommend. I think a lot of times we expect ourselves to be well in a toxic environment, and that's really not possible. In order for humans to be well, we have to have a healthy environment. We're incredibly vulnerable to the people that we're surrounded by and to the environment that we live in. We live in a toxic world when it comes to addiction. So in order to be well, we really need to create a world within a world, what I call self-binding strategies that allow us to be healthier and to protect ourselves from the constant invitations to consume. And that's things like literal physical barriers, getting our drug of choice out of the house, or eliminating the medium through which we access it. So for me, it was like getting rid of my Kindle, right? Making it harder for me to get romance novels. For other people, it's getting the alcohol out of the house or getting the cupcakes out of the house or, whatever it may be. It can be something like deleting the apps that we don't want to use, right? Or going to grayscale, making our phones less potently reinforcing for our visual pathways, turning off notifications because notifications actually release dopamine in anticipation of expected reward. So there are all kinds of things that we can do, in our everyday lives to try to make our environment more conducive to the healthier kind of consumption that we need to engage in to stay.
There was a friend of mine, she deleted social media, so Instagram, TikTok, and whatever. And she told me that she was like scrolling the media page. Like she was changing so the behavior was still there. She was just not using any more social media because she said, no, I will delay that. I'm not interested anymore. But she was, I don't know if addiction is the right word, but it looks like a mild form of addiction. But she was like so informed about everything. She knew like every minute she was scrolling and trying to update the website of the news. And this like made me think a lot about the fact that sometimes we really need a very profound intervention and we're not aware of what is happening in our mind. And we're so used to some like automatic behavior, like you're taking your phone out of your pocket and you need to stare at something, that it's very hard to remove this kind of automatic, like you're putting your autopilot on.
Yeah, that's right. And, these are basically neural networks that we're developing in our brain. Networks are just a collection of neurons, in series that conduct an electrical stimulus. And habit formation is, on the one hand, very advantageous. Like if I had to think about how to tie my shoe every time I tied my shoe, that would be a cognitive lift that would be exhausting.
Yeah.
But at some point, I can tie my shoe automatically. I don't have to think about it. It doesn't take much energy. And what happens in addiction is that we get this kind of habit formation or these deeply entrained neural networks around our addictive behaviors, including the physical things like, the hand scrolling on the screen, like your friend, that are associated with the drug of use. Even just reaching for the phone or finding ourselves driving into the parking lot of the bar, even when we had planned not to drink. These are what we call compulsive, automatic, out of control behaviors that are characteristic of addiction. And this experience of kind of switching from one addiction to another has been documented both in animals and in humans. We call it cross addiction. So, for example, if you train a rat, if you get a rat addicted to, let's say, cocaine, and then you take the cocaine away, and then you expose that rat to cannabis or marijuana, the rat will get addicted to cannabis much more quickly than it would have if it had never been exposed to cocaine. The point being that once we've been addicted to one thing, we're much more vulnerable to get addicted to another thing. So that when we're trying to give up our drug of choice, we have to be very aware and sensitive to the risk of cross addiction, that we'll take that addictive behavior and just transfer it to something else. So that's one of the things that we talk about in clinical care, make sure you don't just do more of X.
Yeah. And talking about the environment, do you think there is a connection between this growing sense of solitude and loneliness and addiction? Like, if I also think about myself and my personal experience, I believe that it's very easy for me to fall into addictive behavior, like looking at social media and feeling lost on social media, or I don't know, with food or shopping or whatever, when I'm alone. So how is that? Is it true that there is this positive correlation? So loneliness reinforces an addictive behavior?
Oh, without a doubt. So, addiction is a disease of isolation, and recovery from addiction means reconnecting with other humans. We really use our drug of choice as a kind of replacement for the deep, intimate human connections that we need to survive and thrive. I do want to emphasize, though, that you can have like the perfect relationship and the best family and the most wonderful network of friends, and you can still get addicted. And what your addiction will do is pull you away from those individuals as you replace those meaningful relationships with your drug. And that's what we see happening all over today. I mean, people are much more likely to live alone. They're much more likely to spend time indoors. And they're much less likely to reach out to others, in large part because of these devices that allow us to electronically make connections, which on the one hand is good. I mean, there's a lot of good about it, but on the other hand is bad because the medium itself has drugified the experience such that even when we're not really making human connections anymore, we're still having that reinforcing illusion of connecting to other people. It's releasing oxytocin and dopamine, and it's hard to stop. And yet, because of that engagement with this illusory kind of connectivity, we become more and more lonely. And I want to emphasize, too, that we talk a lot about young people and how this is affecting their ability to connect with other people, to navigate the world, to tolerate interpersonal conflict or frustration. But we cannot forget older people. More and more people, living alone, who are older or living in retirement communities, are spending more and more time consuming, TikTok, watching Netflix, scrolling Instagram, watching YouTube videos, and spending less and less time connecting, which of course is harder to do when you're older because of physical infirmities, because you've lost people you care about. But we need to care about young people, but we can't forget about old people, because old people are really struggling with this kind of addiction to digital media.
Se avessi un brand online, e ho pensato tante volte di avviarne uno, investirei per creare un sito bello, chiaro, ma soprattutto facile da usare. Il mio percorso imprenditoriale mi ha insegnato che anche il prodotto migliore al mondo può perdersi se l'esperienza d'acquisto non è ideale, non è facile, non è chiara e diretta. Ecco perché userei Shopify. Shopify è il checkout numero 1 al mondo e grazie a ShopPay le conversioni aumentano addirittura fino al 50%. Tradotto, questo significa che i clienti arrivano fino in fondo e non abbandonano il carrello per la frustrazione. Quindi se hai un'attività online o stai pensando di averne una, vai su shopify.it/360, tutto minuscolo, e attiva la prova ad €1 al mese. So actually, when you try to isolate yourself, this should be a warning sign. So when you are deciding between, oh, maybe it's a hard addiction, or maybe I should investigate more that, and I should feel a little bit worried, I would say that when you tend to isolate yourself from your environment, this is a red flag, right?
Yeah. And I think, there's a kind of a natural resistance for most people to sort of going out and meeting up with others. But once we do it, we almost universally feel better.
Yeah, it's true.
Whereas the opposite is true when we give into that impulse to just kind of want to sit on the couch and, scroll or watch videos, we almost always feel worse. So really try to use that signal. Oh, what is the thing that I feel good when I'm doing it, but worse when it's over? Versus the thing that, okay, I don't really want to do it, but I feel so much better when it's over. Because that is a proxy in a way for tracking our dopamine levels, right? And healthy dopamine is the dopamine that we have to work for. And unhealthy dopamine is the dopamine that comes from just sort of that, mindless consumption and numbing and escape.
Tell me more about the healthy dopamine. So what happens, for instance, when we are exercising or doing saunas, cold baths, or eating healthy? What happens to our dopamine? Why did you say that we need to work for that?
Yeah. So if you go back to this pleasure-pain balance or this teeter-totter, it turns out that if we intentionally press on the pain side, for example, by exercising, those gremlins will go over to the pleasure side.
And they move.
They move. They will go wherever they need to go.
Yeah, right.
Because remember, the goal is to level the balance, right?
Yeah.
We don't get to stay in pleasure or pain, for that matter, forever. And they will tip us to the pleasure side, and we will get our dopamine indirectly by paying for it up front. And that way of getting dopamine is much more insulated from addiction, because it's hard to get dopamine that way, right?
Yeah.
You have to work for it.
Yeah.
But what's really fascinating is that studies show that when we exercise or we do an ice cold water plunge, what happens to dopamine is we don't get this sudden dopamine spike like we do with drugs. What we get is a gradual increase in dopamine levels over the latter half of the exercise. And then when we stop exercising, those dopamine levels remain elevated for hours afterwards before going back down to baseline levels of dopamine firing. And they never go into that dopamine deficit state, or they typically do. We don't think they do, which means that we don't set ourselves up for that cycle of craving, intoxication. Now, can people get addicted to exercise? We absolutely do see that, especially when combined with calorie restriction, but it's quite rare. It's quite rare. It requires a brain that has a capacity to endure a lot of pain. Typically, that's not what people get addicted to, although, again, it does happen. The other thing is, we're not promoting here that people would do things like cutting on themselves, right? Yeah. Now, cutting works by that same mechanism, because the mechanism is that the body senses injury, and in response to injury, upregulates feel-good neurotransmitters like dopamine, serotonin, norepinephrine, endogenous cannabinoids, endogenous opioids. So we make our own cannabis, we make our own opioids. The brain is producing those things all the time. And in response to an injury, we upregulate production of those things to protect ourselves from injury.
Yeah.
But what happens if you press too hard and too fast on the pain side of the balance, for example, with cutting, is you will get an endogenous opioid release, to respond to that, but you'll very quickly deplete that, such that with subsequent cuts, it just stops working. Plus, we're cutting on ourselves, right?
Yeah.
And so that's no good. So what's much better is mild to moderate doses of pain or discomfort that are sustainable over long periods of time. And that's things like exercise in moderation, ice cold water plunge in moderation, For people who are not struggling with eating disorders, this would include things like intermittent fasting. If you're struggling with an eating disorder, we don't recommend this. But really, any kind of sustained, effortful engagement. It could be even something like a prayer or meditation practice, or reading a difficult novel, or cleaning out your closet, or writing a letter. In some ways, in our modern world, just unplugging from our devices and sitting in the quiet is challenging for us because
Very
we're
much.
so used to constantly being stimulated. So this in itself is also a form of struggle or suffering or hardship that might help reset reward pathways. A lot of times I'll encourage my patients, try to go on a walk without listening to anything. It's fine to listen to your shows and your this and that, but every once in a while, try to do it without your device, or try to leave your house without your phone. See if you can go a whole day and just kind of observe yourself.
Now, to my understanding, while you're talking, it seems that there are two different categories of addiction. So behavior addictions and substance addictions. What is the difference between the two?
I think there's probably a lot less difference than we think.
Yeah.
But the bottom line is that you can get addicted to both things that you ingest, so things that you eat or you smoke or you drink or you inject, or things that you do. Sex, people are addicted to sex, gambling, right? Shopping, playing video games, scrolling on social media, looking at YouTube or TikTok. Those are behaviors. People argue, well, the one, you're putting a drug in your body, the other, it's a behavior. How can those be the same? What I can tell you is that clinically, the natural history of when people get addicted to drugs versus when they get addicted to behavior is exactly the same. So people start out, for fun or to solve a problem. If it works for them, they'll return to that behavior. Over time, they build tolerance, neuroadaptation. Now they need more to spend more time or more money or see more extreme forms of that behavior to get the same effect. And then eventually they cross the line into addictive use, where the drug isn't really even working for them anymore, but they can't stop. And now they're marshaling all available resources to get the drug, use the drug, high drug use, and then do it again. So that continued compulsive use despite harm. And the harms that we see are, in some cases, life-threatening with behavioral addictions, right? People get addicted to gambling and lose everything.
Everything, yeah.
And get morbidly depressed and want to end their lives. Same thing with pornography, sex, and love addiction, right? Devastating addiction, incredibly shameful as well. A lot of stigma around those addictions, but can be life-threatening. People lose relationships, lose their jobs, end up in jail because now they've progressed to needing more potent, deviant forms of certain stimuli. Child pornography, not even someone who's necessarily a pedophile, but who made their way to that as a result of their addiction, and now they're in jail, right? Or they have legal consequences. Shopping addiction, which affects more women than men. Most addictions affect more men than women, but shopping addiction is more women than men. Social media addiction, more women than men. And the biggest things there with social media is just opportunity costs, all the things I'm not doing because I'm spending all this time online interacting with people who I don't even know, often, or maybe even interacting with an AI chat box. And subtle consequences of addiction are progressive depression, anxiety, loss of joy and meaning. So these are all, really negative consequences.
And before, you told me that your father had an alcohol addiction, and you were likely to develop the same kind of addiction, right?
Well, so about 40 to 60% of the risk is
genetic,
inherited, which is, it's a complex polygenic phenomenon. It's not like one gene. And it also means that, another like 40 or 50%, whatever is not inherited, right?
Yeah.
So it's not a one-to-one, but it just means you're at, if you have a biological parent or grandparent with addiction, you're at increased risk compared to the general population.
Yeah. And it's to the substance, right? Because, for instance, if, I'm addicted to a specific behavior like compulsive eating, is this also passing through my genes or?
It's a great question. And I don't think we really know.
Okay.
Most of the data on the genetic aspect or the heritability of addiction is based on alcohol
Okay.
studies. But what I can tell you is that clinically, there seems to be a clear subset of individuals who is more prone to addiction than
Oh, wow.
others. What we used to call this the addictive personality. We don't use that terminology anymore, at least not in medicine. We just talk about like risk vulnerability. But it's very clear that some people early on, just have a propensity to do things in the extreme and have a propensity to get addicted. And it seems very innate. But there are other risk factors for addiction, not just genes, right? So other risk factors are things like a co-occurring mental illness puts people at increased risk for addiction. Early childhood trauma puts people at risk for addiction. Poverty, unemployment puts people at risk for addiction. Living in a place where drugs are readily available, so access puts people at risk for addiction. So you can sort of lump them into nature, nurture, and neighborhood in terms of the multiple risk factors for addiction.
Nature, nurture, and neighborhood.
Yep.
I love it. And also, we often speak about this negative sides of addiction, but I believe that there is something related to work, success, ambition that is not very well discussed. And to me, it's not very clear, like when a passion or let's say something that you do and that gives you a lot of pleasure, and you do also because you have a vision and a mission, becomes an addiction. So myself, like I changed job for since 2 years, and I have this feeling that I'm very driven by what I'm doing, to the point that sometimes I wake up in the morning and I feel this urge to do work-related stuff, and I find myself thinking more often about work than I used to before. Is this, I don't know, a beginning part of an addictive behavior, or being very late at night working and working in very, very high pressure environments? Is that compatible or comparable as an addictive behavior? What are your thoughts on that?
It really depends on the person and the circumstances. It would be impossible to evaluate without a lot more information. What you're describing does not sound like somebody who's addicted, because it's consistent with your goals and values. You're enjoying it. I haven't heard you mention any negative consequences as a result. Now, when we think about workaholism or people who are addicted to work, because we as a modern culture celebrate workaholism, we're also going to be less likely to recognize the negative consequences. But the kinds of things that come up for people who do either self or other identify as workaholics is working to the point of not of neglecting their own physical and mental health, or working to the point where they lose primary relationships that are important to them, that they want to preserve, but yet can't stop working long enough to pay attention to the people in their lives. Those are the kinds of negative consequences that we would really need to hear about in order to say, okay, this is a problem.
Have you ever had patients who were addicted to work? Or
I mean, it does come up as people begin to sift through the sands of their lives and try to figure out what's of value to them, and try to then, as they get into recovery, just in general from life, if not, another addiction, try to figure out, what is important to me when I look back on my life. What do I want to say, I spent my time doing? I mean, those kinds of things do come up where people, well, why am I working as hard as I'm working? Is it that it's really consistent with values and meaning and purpose, or am I running away from something else? Is this just a way to get sort of validation or manage my insecurities, or am I on some kind of hamster wheel that even I don't know why I do it, but I can't get off even when I want to? Those are the kinds of things to think about.
Yeah. And I also think that the problem with ambition, or let's say work to the extreme is that, as you said, there's not a problem with the society, and there's not this level of shame. So,
Well, there's the opposite, right? Where
there's
the
proud.
celebrated
Yeah,
workaholics are like our modern day heroes.
Yeah. And so it's even harder, I would say, to pull you out, because if you're telling to someone that you're staying at home just to watch your favorite, I don't know, TV series or reading something, then it's different. Or I don't know, having drugs or alcohol, it's different than you're saying, no, I'm just staying at home because I need to work.
Yeah, right.
Everyone would
right.
say, wow, you're a hero. Good job.
Yeah, right.
Yeah.
You're the best. You're such a
Yeah.
hard worker.
Yeah.
Yeah.
Mm.
Yeah, no, it's very, what we deem an addiction versus a passion versus a habit, bad habit, good habit, is very intertwined with our culture and where we give meaning and value. I do think that we're living in a time when we so overvalue work and money and fame and power, which has always been, I think, the human tendency when we aggregate in societies. But we've drugified work, right?
Yeah.
We now have bonuses and stock options and social media, glory through various work endeavors. So it's gotten harder and harder to navigate. And I think, as with any drug, when we're caught up in it, we can't really see the harm. It's when we get some distance from it that we're able to go, oh wow, yeah, like I don't want to really live that way.
What are some recent forms of addiction that you've seen? Like some things that didn't come up in up until the last 5 years or 10 years. Something that you said, wow, this is new. Like,
well, I guess some recent forms would be things like addicted to the news or doom scrolling. Like you wouldn't think, well, why would that be addictive? But again, dopamine is very responsive to novelty or anything new. And now we have this sensationalized form of news media that doesn't really give us new information, but it just tells us what we want to hear about the world in a new package. So that's a big one. A shopping addiction online is a big one, where people are like ordering coffee cups and cheap sunglasses, keychains, even things they don't even want, just to be able to perpetuate the cycle of ordering something, anticipating it coming, having it delivered by Amazon, unwrapping it, only to find that the moment they get it, they don't want it anymore. I have patients with rooms full of unopened Amazon boxes.
They don't even return them. They keep them.
They sometimes they can't even get themselves together enough to return it. They just on the treadmill. And then, there's always new designer drugs of all sorts, like old drugs being repurposed and repackaged as health food products. So, that comes up all the time.
Yeah.
Just like, well, we live in like the wellness industrial complex now. There are all these supplements. Quite a few of these supplements have things that we would consider to be, addictive drugs, high doses of caffeine, or plant forms of opioids that people aren't even realizing they're drinking in these health food drinks. So that's also comes up.
What do you think is the role of shame in this cycle? Because as I said, I feel that it's very hard to admit that you have an addiction, first of all to yourself and then also to others. And there is this painful feeling of saying that loud.
Yeah. Well, shame has a big role in perpetuating addictive behaviors. People feel a lot of shame about their compulsive overconsumption, hiding it from other people. Often people are engaging what we call the double life, where they seem to be one person over here, but then they have this secret addiction, that they're hiding from others. And there's a lot of shame involved in that. And very often that shame can drive continued use, because shame is a very painful gut punch of an emotion, which combines sort of the fear of condemnation with the fear of abandonment or being kicked out of the tribe. But on the other hand, if we didn't experience any shame at all, for these kinds of behaviors, we wouldn't be motivated to change the behavior. So shame can also be a huge factor in propelling us into recovery. So it really becomes a matter of how do we take sort of what I call pro-social shame or appropriate shame for behaviors that we regret and that we want to change, and respond to that in a way that allows people to get into recovery, as opposed to respond to it in a way that just further drives them underground. And so I talk about this concept of radical honesty and how that can be a really important starting point for turning shame into a vehicle for recovery. And it really starts with just like being honest with ourselves and with others about what we're doing. What are we consuming, how much, how often, what other behaviors have we engaged in related to getting our drug, using our drug, hiding our drug? Because very often, whoever we are, if we get deep enough in our addiction, we go outside of our moral compass as our integrity and our morality gets hijacked by our drive for the drug. So just simply, admitting it to another human being and then being embraced by that other human being, not being rejected, is a really important starting point. And that's where mutual help groups or peer recovery groups like Alcoholics Anonymous, Narcotics Anonymous, Sexaholics Anonymous, and other groups can be so helpful. People often describe them as incredibly de-shaming, right? Because all of a sudden you're surrounded by people struggling with the same problem. Wow, I'm not the only one. But also by admitting, what we're doing, it's a kind of a cleansing and a way to kind of start over. And so I think shame has this interesting dual kind of role.
Yeah. And if anyone who is listening is struggling with an addictive behavior, or it's like failing to pull himself or herself out of this pattern, what are some practical suggestions that you would give to them? I feel that probably someone who is listening is recognizing himself or herself in some of the patterns that we've described. And then it's like, yeah, but then what's next? What should I do now?
Right. Well, I think if you have a milder addiction, or maybe you're not even really addicted, but there's just a behavior that you do too much of, or a substance you ingest too much of that you'd like to change, I recommend a 30-day dopamine fast from that behavior. Now, this is as old as time. Every major philosophy and religion recommends a 30 days or so of some kind of abstinence protocol.
So you leave aside the behavior or the
you prepare for the fast by letting people know, if you're comfortable doing that you're going to do that. You get your drug out of the house. You have other self-binding strategies. You maybe get rid of, if you're going to get off of TikTok, you delete the app. You set it up, prepare for it. And then you try not to use it for 30 days, anticipating that you will feel worse before you feel better. Why? Because when you take your drug of choice off of the pleasure side of the balance, all of those gremlins that have been accumulating on the pain side of the balance will smash you down to the side of pain. And you will experience intense cravings to use, all kinds of rationalizations why you should use, even though you committed to abstinence for 30 days. You'll be anxious, you'll be irritable, you'll be restless. But it is time limited. If you can just get through those first 10 to 14 days, you will begin to feel better. And this is always a shock to people. Patients will be like, my cravings are so bad, I said, I know, but it's time limited. And then they'll get to week 3 or week 4, and it's like, it's amazing. The cravings are going away. People can't believe it. So just really, whether it's quitting smoking or quitting sugar or quitting video games or pornography and masturbation, whatever it is, that's my recommendation for an early intervention. Now, if you're somebody who's repeatedly done that and hasn't been able to quit, or you've quit and you've always gone back and it's worse than ever, then I recommend either going to see a professional who's trained in addiction treatment, or seeking out one of these 12-step groups like Alcoholics Anonymous, Narcotics Anonymous, or whatever anonymous, Food Addicts Anonymous. There's pretty much every group you can imagine. And trying to work the 12 steps as an intervention, which, by the way, is also evidence-based. We know that people who actively engage in 12-step recovery have outcomes that are as good as people who go and see a professional.
Mhm.
And if you stretch that out to a year, Alcoholics Anonymous and other 12-step groups might actually work better than going to see a professional.
What is this 12 steps group? So what is the intervention based on? What happens?
So Alcoholics Anonymous, it began in the 1930s, and it's they call it a spiritual program, but it doesn't need to involve a religion. It's they have their 12 steps.
Okay.
The first step, is admitting we are powerless over this consumptive behavior. And the first 3 steps are essentially giving over of our will to a power outside of ourselves, however we define that. So that could be the wisdom of the group, the mystery of the universe.
Okay.
And then, the belief that greater power can restore us to sanity. So there's a bit of a paradox here, right? Because essentially we're saying, you have to be responsible and go on a 30-day abstinence fast and prepare for it. And you do all these things. But on the other hand, 12 steps is saying, but in a very real way, you are powerless. And for you to get back agency, you have to admit your powerlessness and hand that over to a power greater than yourselves. All I can tell you is it works.
Yeah.
It works. Now, it doesn't work for everybody, right? But for the people who actively engage and who work the 12-step program, it often works better than anything that I can prescribe or provide. So that spiritual solution is really, really powerful.
Because in terms of interventions, like, what do you think also helps? Like, do you think meditation, mindfulness practices are playing a role in this recovery?
Absolutely. I mean, so what is mindfulness? It's the ability to observe our thoughts and feelings without judgment, and also without trying to escape those thoughts and feelings. And our drug of choice, whatever it may be, whether it's our smartphone or alcohol or a joint, that's the way we escape our thoughts and feelings, right? So that 30-day, dopamine fast or that abstinence trial is a great opportunity to practice mindfulness and just kind of learning to sit with those uncomfortable thoughts and feelings, watching them wash over us and then watching them dissipate. So mindfulness practices are great. Meditation practices are great. Prayer practices are great. All that stuff, whatever is sort of non-self or other destructive and works is good.
Do you meditate as well?
I'm not like a classic meditator where I sit down and do like the breathing or listen to the apps.
Yeah.
But I probably do the equivalent through walking and swimming, a kind of movement meditation. And I engage in prayer. So I think those are all probably roughly equivalent.
And what do you think are the future scenarios? Like, how do you envision the future of addiction treatment? Like, I don't know, what other interventions would you make if I may ask you?
Well, addiction is what we call a biopsychosocial disease. So there are biological risk factors, psychological risk factors, and social environmental risk factors, as we've talked about. And so when we think about intervening, we need to think about intervening at all of those 3 places. So when I think about biological interventions, I mean, a really exciting development is the GLP-1 agonists like Ozempic and Wegovy, originally approved for diabetes and obesity, but now showing some early efficacy in food addiction, in alcoholic addiction, in alcohol use disorder or addiction to alcohol. It looks like those GLP-1 agonists, these medications, they work on the gut hormones, but they also work on dopamine release in the reward pathway in the brain. So this is an exciting new medication. And I think that we'll just have more and more medications that are going to be developed that target appetitive control at various points. And frankly, it's a way of adapting to a very toxic environment, which is mismatched for our ancient wiring. Our ancient wiring tells us to go out and consume everything we can as much as we can whenever we find it, because we might not find it again,
anymore,
right?
Yeah.
But that's not true for the world that we live in now. So I think these biological interventions, people are looking at transcranial magnetic stimulation, also, using a magnet to modulate electrical circuits. And these are being looked at for addiction as well, using the transcranial magnetic stimulator to decrease activation in those deep limbic structures that are rich in dopamine releasing neurons, essentially quieting those down while increasing activation of the prefrontal cortex, which is the large gray matter area right behind our foreheads, which is so important for delayed gratification, future planning, appreciating future consequences, all of the things that go into appetitive control. So that's an exciting area.
Wow.
In terms of psychological and psychosocial interventions, a lot of people are looking at the ways in which AI and digital media might be able to help us manage our appetites and live healthier and in balance. The problem is the medium itself, has the tendency to be reinforcing. But I think we have to keep trying and see what we can do to have a healthy relationship or a healthier relationship with digital technology and looking at how digital technology can actually inform our lives in positive ways. So there's that. And I mean, I think also, we're already seeing ways that sort of cultural norms or memes are changing around certain types of consumption. I don't know about in Italy, but in the United States, there's just in the last 5 or 10 years, there's been much more awareness of the dangers of alcohol consumption, which is sort of interesting because we've known for hundreds of years, but there's sort of like a dry movement, which is interesting. So I think sort of these cultural memes or norms I'll be interesting to see where that goes in terms of how people think about how they want to live.
I have one last question.
Yeah.
So you have spent like decades understanding dopamine and addiction. You have such a deep level of knowledge, and it's so interesting when you talk about these topics. Like, it's very fascinating. What do you feel is still the biggest unanswered question in your field?
I'm very interested in how sort of the deeper questions of meaning and purpose, inform our lives. I'm very interested in spiritual transformation. And much of that has really been excluded from mental health in a weird kind of way. So I'm very curious about that and how we can learn more about, how people find meaning and purpose and what it is to live the spiritual life and how we can integrate that better into medical practice so that we're not sort of having this siloed experience of like, well, here's Western medicine and then here's all this other stuff going on over here and never the twain shall meet. So I think that's an important area.
Yeah. Thank you so much, Anna. It has been like a wonderful conversation. Deeply appreciated.
Well, thank you.